In just a few days, kids 5 to 11 can finally get a dose of the COVID vaccine. And for some families, it's a relief.
We plan to get it the first minute it's available.
I think it's best for everybody. We'll probably get it.
For sure, I will take him to a clinic to get a vaccine.
But for these kids, the thought of getting a needle doesn't evoke the same enthusiasm.
I'm scared to get my vaccine because I'm scared of needles.
I'll be screaming in pain.
2.9 million Pfizer vaccine doses for children are expected to arrive by the end of this week, and some provinces have started to share their rollout plans.
The addition of the vaccine for our 5 to 11-year-olds puts us one step closer to ending the pandemic. Saskatchewan
says it plans to start vaccinating kids by Wednesday. Ontario, not far behind. Its provincial booking portal opens Tuesday morning.
We should be able to start getting shots into little arms by about Thursday.
Depending on where they live, kids can get their shots at doctors' offices, pharmacies, and clinics. Some provinces are setting up vaccination sites in schools, both in and out of class time. Experts say the key for parents or caregivers is to address their kids' worries.
What I think is really important for parents to do is to bring their kids into the conversation, help them feel a sense of agency when it comes to making this decision.
There are many battles left to fight, and losing is not an option.
Some regions are calling on superheroes for help.
If you're 5, 6, 7.
For 5-year-old Jake Fernbach, it will take some convincing. As for her dad, he says he's made 2 promises to his daughter if she gets her shot.
Probably give her a candy. Pretty easy, yeah. And a promise maybe she could travel with me too.
For the Fernbachs, like many others, a shot means a long-awaited reunion with loved ones. Tashana Reed, CBC News, Toronto.
Dr. Cora Constantinescu joins us right now. She is an infectious diseases specialist with a vaccine hesitancy clinic at the Alberta Children's Hospital in Calgary. So that makes you perfect for this discussion. You know, by and large, Doctor, we understand that the infections have been relatively mild in this age group. So what do you say then to parents who feel that maybe getting their kids vaccinated isn't entirely necessary?
Yeah, many kids have had really mild disease, but not all kids are so lucky. We've seen kids in hospital, in ICU, with acute COVID, but also with multi-system inflammation. And in the US, when they looked at kids who are hospitalized with COVID, 1 out of 3 were previously healthy kids. And then in addition, we have this whole collateral cost that our kids have paid to this pandemic. The learning loss, socialization, mental health, family health. I would say this virus has not spared our kids.
Okay, one last thought. These are excellent answers for parents, but there are kids out there who are nervous too as the shots roll out this week. What would you say to, say, an 8-year-old in your clinic who is nervous about this?
So first, talk to them about the plan and provide a comfort plan. So what would their preferences be? How do they want to be held? Do they want to do it on their own? Do they want to be in your lap? Do they want to do it lying flat, sitting up? You can use numbing cream as well to help them with this pain. And then overall, use really positive language. So praise them for the stuff that they do right. You know, for showing up in the clinic, even though it was scary, for relaxing their arms. And then if all fails, you shift attention. So you can use electronics, music, games, slow, deep breathing to help them through it. So have a plan. And above all, remember the kids are going to mirror your feelings and your attitude. So you put in that positive attitude when you take your kid for the vaccine.
That's always a good tip. Dr. Constantinescu, thank you.
Thank you. Have a good night.